My name is Dr.Ben Bluestein. I'm a chiropractor here at Align Chiropractic Healthcare Center in central Hong Kong, and today we're going to be talking to you about ankle injuries and give you some quick little exercises on how to increase your mobility in your ankles to help take pressure off of your knees and other joints in your body. So whether you had an ankle injury or not, the next set of exercises will allow your body to increase its range of motion and improve those areas of stiffness that you might be suffering from. These controlled rotations done at varying speeds and angles will allow your body to improve its range of motion. In sports, most common injuries to the ankle tend to be sprains. So anybody that's ever played a sport has sprained their ankle. Usually these things can be traumatic, either if you step on somebody's toe or foot and your ankle goes inwards, you catch something in the ground and your boot kind of gets caught and you get your foot caught in there, or it gets rotated. The two biggest types of ankle sprains are an inversion ankle sprain and an eversion ankle sprain. So an inversion ankle sprain is usually when the ankle gets bent inwards this way and it stresses all the ligaments and the muscles along the side of the leg, and that can cause swelling and tears along the soft tissue and the muscles and the tendons along your outside of your ankle. The other type of ankle sprain is the eversion ankle sprain, which happens when the ankle goes this way. Those ones tend to be a little bit more severe and they can cause pain on the inside of your ankle. So even if you haven't suffered an ankle injury or ankle sprain before, a lot of sports athletes who do running, jumping, kicking, they tend to report stiffness in their ankle either before, during, or after their activity. So what I do like to emphasize is that patients have strength and mobility in all ranges of motion. So whether it's up, down, side to side, or all around, I like to make sure my patients have full control in all the areas of motion in there. So we're going to get into explaining why controlled rotations, which is the exercise to help improve a little bit of stiffness and mobility in your ankle, why that's important. The reason why it's important is because sometimes your brain cannot communicate to the muscles that control the joints. So we want to try and improve that communication. So what I do like to do is give patients these on a daily basis. And what this will allow them to do is allow them to grasp those ranges of motion. So this next exercise is going to be done in a squatting position. If you have any problems with squatting or issues with your knees, this might not be the best position for you. So be careful when you perform this exercise. This exercise is a closed exercise. So what that means is that your foot is affixed, is stuck on the ground. So there's no open area of your foot to move. So what you're going to try and do is you're going to try and move your body just with your muscles of your ankle. So we're going to try and do the same type of thing that we did with the first exercise, except we're going to try and control the rotations of your ankle. So if you look at my ankle this way, you can see the angle closing off and opening. And you're going to do it in the same thing a little bit faster like this. And then we're going to go the other direction like this. So I do like to do about 10 of these before, I do like to give this, before a patient or an athlete goes to do their sport. So the next exercise is called the prayer stretch. I'll give two kind of positions, one easier and one a little bit more difficult. That will help improve your strength and your motion throughout the front part of your leg and the back part of your calf area, as well as the bottom, the arch of your foot. When people have had ankle injuries or report stiffness, they report that those areas tend to be the most bothersome. So we'll go into that stretch right now. The prayer stretch is done primarily, I want people to be able to sit on the back of their heels. If they can't do that, then what we do, the easier version, is just to have to be on a quadruped position, kind of on all fours, with your toes pointing down like this. So what you want to do is when you sit back, you might just feel a stretch kind of along the bottom part of your feet here, as well as in kind of on the front of your legs over here. So with this exercise, you want to practice pushing and pulling. So with the pulling, you're going to try and pull your legs back like this, activating the front part of your legs over here. You're going to pull, you're going to hold that for about 10 seconds, and you're going to relax, and you're going to push down like that. Push with your big toe into the ground this way like that. I'll push, you're going to push, you're going to hold that for 10 seconds as well, and you're going to pull and come back. Just nice and slow. So these can be done before the games as well, just nice and quickly like that, holding and pushing and pulling 5 times each direction. What that'll do is allow your body to, get it communicating with the muscles so that you're more warmed up and more able to perform your sport.